afternoon. Well, I'm so nervous because my language is Portuguese. I don't speak very well. I don't know why they choose me for here, but I will try well. So, it's a pleasure to be here with you today to debate this theme, the effects of health literacy on people aging with HIV. Firstly, I want to thank you because I come from Portugal. I represent the Portuguese Society Health Literacy. And this invite to be here, it's very good to us to share our experience with you, and I hope respond to your expectations. And I want thank you for my colleague Catarina Esteves. She'll go away, but I thank her to hear. So let me see this slide. Okay, this is my disclosure. I work in Lisbon. I work in a big center hospitals, 6 hospitals. My activity every day is about patient safety. I'm responsible of patient safety activities. We have accreditation, English accreditation by CHKS. Today I share with you a little bit about our society. Our society is about health literacy. We have many persons about these activities, and we want to work many things: scientific, formative, technical, organizational, ethical, and human purpose. We want to promote in Portugal the health literacy in citizens, but also in professionals' healthcare. This is our team on the board. Professor Cristina Vaz de Almeida is the president. She's from this society, and me and my colleague Mariana Fonseca. We have many professionals, many areas here, and together we make many activities in the hospitals and in the community also. We have a motto, our motto is literacy is good for health, we all win. So we start only in January 2022. We are very young in these activities, but we have amounted to 116 people with us together and work together in these activities. Our goal is we propose to improve the access, understand and use health resources, and we want to help persons navigate in the system because we know it's very complex, and we want to improve these navigations and the things that the people don't know with the professionals, and we want to help them to make decisions right and informed. So we have several projects, and I bring that project with about safety medication. We work with the older people, in the university people, older people, senior people, you know, and we make some co-creations about materials with the safety medications and vaccinations. And then they make some materials to show to the community. We have also this project. This project is about healthy eating. We make some videos, and We discussed with the citizens some podcasts and the strategies to better diet and a better life with the eating better. We have also tried in this month a project we call them Rhythm project. So we have many persons with different areas with food, physical activities and well-being, and it was very interesting, the activities with the citizens and these activities. And another project is about the pain. We wrote with patients and professionals a guide resource for pain and how to do for release and measuring the pain. So I came here for talking with you about health literacy, and I brought this. So what is it? We talk about that many times, and sometimes people don't know what it is, literacy, health literacy. So when we talk with the patients, sometimes they don't understand what we are saying, and we want to help them and involve them and motivation them for better skills, assess, understand, and evaluation for taking decisions informed. I brought, sorry, yes. I'm sorry. I have a story for you. Well, in this story is about literacy, health literacy. This is a true story that happened in our hospital. Nurses in service have a routine of spending their shifts with patients. The patient heard that she was epileptic. When the nurse went to the patient, she was crying a lot, and she asked what was happening. The patient said that she was very scared and that she knew that the professionals were hiding what she really had because she heard that she was epileptic. So the principal asked is, do professionals encourage the patient to participate, encourage them to ask questions? Sometimes we talk, or many times we talk a lot with the terms that the patients don't understand the things. So any technical language is a conspiracy against the layman. We must work a lot about that. So there are several studies, studies about effects of health literacy on people aging with HIV. And I brought 3 studies. They flagged the interest in this subject over a decade, and I'd like to need to continue this investigation, the effects of health literacy on people with HIV. Health literacy, as you see in this slide, affects vulnerable people, communities, like the person with HIV. It's a big problem, and we need continue research about that, about our interventions in patients, and we must work a lot with patients and co-creations, the interventions with them. Another study, systematic review, the same conclusions, and this study happened about 2017, and the same conclusions are found in this study. So health literacy interventions have the potential to promote HIV-related knowledge, behavioral skills, and self-management practice. We must go on research like this study. This study is very, very recent, 2023, and they say about problems of these people, and the conclusions is that people with adults with HIV, and the problems with that people is that they are 3 times less likely to experience aging as compared to older adults with HIV. So we must continue this work. This is a doctor, Dr. Telo Faria, Portuguese doctor, and they say literacy in this area is fundamental because more informing the general population is about infection. Not only will they be able to better protect themselves, but literacy will promote the full inclusion of HIV-positive people in all areas, social, professionals, and family. We talk about the stigma, you talk about the stigma all day. It's very important to know that and fight about that, so health literacy can help this as an important role play. I brought a testimony, Ricardo Fernandes. He is a chairman of GET, a Portuguese activist group on treatments. He spoke a little bit more English than me, and I brought a little video, and I will try this video. Can I try that?
Getting older with HIV and living longer with HIV as well. We are, of course, talking about literacy, but also taking all the opportunities where people meet, be it health services or NGOs to approach this issue. I think that, for instance, when we are talking about health services and having in account that people living with HIV have to go to health services regularly, at least twice a year when they are stable. I think that it's important to have a moment where we can assess adherence to treatment, and we can also do some literacy around treatments and also the disease living with HIV. So it's important to have strategies to measure, but also strategies that can, of course, be tailored to the needs of people, be it culturally, be it linguistically, be it as well having, in attention the actual circumstances of people, because they might change, with time. So I think that this is the first thing, that health services need to be fine-tuned and tailored so that people can have an answer that is most adapt to them, and not, general answer to everyone, which we see that it doesn't work. And then prescription. When a doctor is doing a prescription, I think that it's important not only the doctor to think what it is more comfortable for the person. It might be, an injection, it might be a daily pill, it might be twice a day, it depends. But I think that we know what is more comfortable, or we think that it's more comfortable, but I think that it's important to discuss with the person and to make sure that she has the same opinion, because if she agrees, it's already one step to a better adherence, because I think that someone that agrees with his own treatment is already motivated to do it. So I think that's important. Then, of course, there's a lot of ways to increase the literacy, but I think that the literacy needs also to be tailored, because people come from different cultures, they have different backgrounds in terms of academic studies. So I think it is important as well to adapt the information, but also to be realistic in the kind of information that we can give, to the several populations with whom we are working with. But literacy is certainly important, be it presential, be it through programs, training, or even printed or online materials. And lastly, what I would say that is very important to ensure that if people are getting old, that they also have some social assistance, social support, meaning that they should have nice social networks, people around them that can support them in this effort of adherence, which can be more difficult to some people and easier to others. But if they have a social network around them, and if they can activate this social network when they need, this is already a good way to make sure that they get in better adherence to treatment. So I would say that this is the important things in my mind, but of course I guess that there's much more that we will be discussing today. Thank you so much. Bye-bye.
Thank you, Ricardo Fernandes. He lived with HIV 24 years, and he has worked with many people with HIV almost 20 years. He knows a lot about this thing. So this slide represents a diagram and reflects the importance of all professionals, patients, and families and citizens integrate this concept together all the time, integrate health literacy as something natural in our behaviors and interactions, promoting integrated patient empowerment for safer and more humanized healthcare. It's important to do together these activities for better health of all. So it's important to speak about empowerment. If you speak in health literacy, you must speak in patient empowerment. It's a complex process. Everybody who wants to know about health and about the terms of health and about what asked to the doctor, it's very difficult and complex to the patients and to the people, the persons don't know about that. So if you want to empower the persons, you must interact with them and help them understand what's happened with them. We have many information in internet technology, internet access, mobile apps. It's a big problem, and the professionals must to do something about that and help the patients to know what's the better choice. So it's important in the empowerment patient speak about information, health literacy, more digital literacy to all of us, self-efficacy, mutual respect, it's very important, joint decision-making in the environment supportive. So I finish with this project that our society work with some associations in Portugal. It's a HIV project, and it's about co-creation, the things about HIV for more better health. So the people participate on research, and we give more results with more quality life and better public. So in this co-creation can show the way for more solutions, and the patients participate, patients with many multimorbidity and less than optimal health literacy. So we help them to understand and to face the obstacles in navigating in the healthcare system. So we make together a persona's avatar to help them understand things in their lives. And we promote many activities with them. And this is the associations work with us in Portugal. And this is a very good work together, and we learn a lot of these problems of the people aging with HIV. So the co-creation with the support of MISD help us to do, and you can see in this site the things what we are doing about that, to inform the citizens about the problems and about the things we can do to better understand the problems of people aging with HIV and help them to a better life. This is a picture of the information we work together with them. And this project, VIV project, I'm sorry, I'm finished. But I want to say this co-creation process was organized into 5 stages. First, we identification the main targets with the groups and the message objectives. And then we prepare with the collaborative preparations with the patients insights based on personal patient profiles. So these sections was very interesting. In the final results, it was very good videos and some podcasts and many informations to the persons and to the citizens. So, last, people aging with HIV, it's a big impact of health literacy, so we must to be a growing area of research, we must continue research this area. It's necessary to combat stigma and discrimination, and inclusion HIV positive pupils in social and professional and family environment. It's very important to do that. So I'm finished, and I'm sorry, my English, it's not very good, but I'm trying.